Specifically, we're looking at interventions that have validated outcomes for low back that do not involve opiates. And we can see that low back pain is a big problem in this country and worldwide. Surely it costs our society a huge amount of money. I think these are probably underestimates if anything, and it's probably the most common diagnosis that I see in my clinic, for sure. But again, looking for options that have validated outcomes that do not involve opiates is pretty important, and that's the whole premise behind this society, is to come up with interventions to help with all sorts of pain, back pain being a big component of that. And so this middle portion is kind of where we live as interventional pain physicians. This ideas of different types of injections, kyphoplasties, emerging disc therapies, and such,